Hello to all my friends and to all my colleagues and to all my students and my fans everywhere. This is Professor Dr. Tarek Ali with you. My live broadcasting today is about alveolar disorders or alveolar diseases or alveolar pulmonary diseases. طبعا it is a topic for healthcare professionals in general, not for the public. To start with, the alveolar pulmonary disease or the alveolar disorders or the alveolar diseases, these are a group of lung diseases or lung disorders which primarily affect the alveoli by a pathological insult, which primarily pathologically involve the alveoli. So the part of the lung which is affected by these pathologies is the alveoli. And the alveolar are the air spaces or the smallest air spaces of the lung, which are the termination of the what we call the pulmonary acinus, and they are responsible for gas exchange, as we all know. They are responsible for gas exchange. So the alveoli are gas exchange units of the lung, through which the gas exchange happens. The oxygen enters from outside, and the carbon dioxide goes from inside. So the alveoli are the gas exchange units which are responsible for the exchange between oxygen, which is delivered inside the body, and the carbon dioxide, which is delivered to the outside of the body, as we all know. In short, the disorders or diseases which affect the alveoli are mainly the following. Number one, the chronic obstructive pulmonary disease, which is called the emphysema. Not the chronic bronchitis. The chronic bronchitis, it is a COPD which primarily affects the airways. The airways, that is the bronchi, not the bronchi and bronchioles, not the alveoli. But the other category of COPD which affects the alveoli is namely the emphysema. So emphysema, it is an alveolar disease. And emphysema, there is an expansion and overdistension of the alveoli with destruction of the alveolar septum, which causes expansion of the airways and reduction of the surface area of the lung. And when the air spaces, they communicate together and there is destruction of the alveolar septa, they form what we call the alveolar blebs or the bulla, which is characteristic pathologically of the emphysematous lung, the emphysematous bulli. So in the bulli is nothing but alveoli which have merged together, and their alveolar septa have been destroyed by the pathological process. So there is hyperinflation, there is hyperexpansion, there is formation of larger air spaces, not the usual alveoli. The usual alveoli, the normal alveoli, anatomical alveoli are destroyed, the septa are damaged, and then they fuse together and form larger spaces so that the surface area of the lung will be reduced in this pathological process of pulmonary emphysema. So this is the first disease, and as we all know, the emphysema, it is one of the spectrum of the COPD, because we know that the COPD or the chronic obstructive pulmonary disease, or the COAD, the chronic obstructive airway disease, or the COD, that is the obstructive airway disease. At one end of the spectrum, there is emphysema. At the other end, there is chronic bronchitis. The chronic bronchitic predominant COPD people are called the blue bloaters because they are characterized by having chronic bronchitis pathologically, which is the production, which is cough with production of sputum for at least 3 months every year for at least two continuous years. So that will be called chronic bronchitis. And we all know that the main risk factor and the main predisposition to COPD, to the chronic bronchitic or chronic bronchitis, or the chronic bronchitic category, is smoking, especially cigarette smoking. That's why we have all to stop smoking in order to reduce the incidence and the prevalence of COPD in general. So this is the chronic bronchitis. But the emphysema, and as I mentioned, anatomically, the chronic bronchitis affect, as it's clear from its name, it affects the bronchi, that is the airways. So it is an airway disease. And there is what we call obstructive hypoventilation, pathophysiologically or pathobiologically, is characterized by hypoventilation, which is obstructive hypoventilation, because as we all know, there is another type of hypoventilation, which we call it restrictive hypoventilation. But this type caused by chronic bronchitis, it's called obstructive hypoventilation. And it is characterized by the accumulation of carbon dioxide. So there is usually associated with type 2 respiratory failure, or what we call in the end stage, this is what we call hypercapnic respiratory failure in chronic bronchitis. In emphysema and the chronic bronchitic patients are plu bloaters because they are plu due to the hypoxia, and bloated due to edema, due to cor pulmonaire with right-sided heart failure. So at the end, the patients with chronic bronchitis are edematous, that is bloated, and they are plu due to hypoxia. So there is central cyanosis. This is in the end stages of untreated, neglected chronic bronchitis. But in emphysema, on the other hand, there is, we call them pink puffer because they have secondary erythrocytosis or secondary polycythemia due to the hypoxia as a result of the obstructive hypoventilation. So there is erythrocytosis, so they are pink and puffing because they are clinically predominantly puffing through pursing of the lips or through pursed lips, and they are dyspneic. So the main manifestation of emphysema is shortness of breathing, that is dyspnea or shortness of breath, while the main presentation of chronic bronchitis is cough with sputum. So again, in emphysema, which is a disease of the alveoli with expansion of the alveoli, destruction of alveolar septum, and inflation of the alveolar units of the lungs, there is pink puffing criteria, that is secondary polycythemia with shortness of breathing through pursed lips, which is characteristic of patients with emphysema. So this is number one disease of the alveoli. Number two disease of the alveoli is pneumonias, or what we call alveolar infection. The alveoli are involved by a pathological process due to an infectious cause, whether bacteria, viral, or fungi, or parasites. These are called pneumonias. And pneumonias, it is a pathological process of the alveoli. It is an alveolar infection by an organism, a microorganism, most commonly bacteria and viruses. So we have bacterial pneumonias, whether lobar pneumonias or bronchopneumonias, or interstitial pneumonias or atypical pneumonias. All pneumonias involve the alveoli. It is involvement of the alveoli by an inflammatory infectious process. By an inflammatory infectious process. So this is, and the alveoli get airless. And they are characterized pathologically by consolidation, that is airless alveoli or airless lung, because the air inside the alveoli is replaced by a suppurative fluid or by pus due to the infection. As I mentioned, most commonly bacteria and or viruses. So we have bacterial pneumonias and viral pneumonias, which are the most common causes of pneumonias. So pneumonia is also a disease of the alveoli. Number three, alveolar fluid inside the lung, namely what we call alveolar edema. So accumulation of fluid inside the alveoli, as it happens in left-sided heart failure, at the end stage of lung edema. First there is interstitial edema, and then this progresses to alveolar edema with pulling over of fluid inside the alveoli themselves, causing the alveolar edema, which is fluid inside the, namely water inside the alveoli, which of course is a drastic pulmonary, acute pulmonary disease, and it is a medical emergency. The most common causes of whether the edema is due to cardiac cause, which we call it cardiogenic pulmonary edema, or non-cardiac cause, which we call it the non-cardiogenic pulmonary edema, as it happens in patients with acute respiratory distress or ARDS, or the acute respiratory or the severe respiratory distress syndrome. The pathology here, it is fluid inside the alveoli, not due to a cardiac cause. So the most common two categories of pulmonary edema or alveolar edema is cardiac alveolar edema due to left-sided heart failure, which is very common and which is more common, and the most common cause of which is acute myocardial infarction, this heart attack with acute left-sided heart failure causing pulmonary edema. And number two, hypertensive heart failure, also in severe hypertension as a hypertensive emergency or urgency, causing acute hypertensive left-sided heart failure with pulmonary edema. So this is also a hypertensive pulmonary edema, which is another or number two cause after myocardial infarction or heart attack. In addition to other cardiac causes, of course, like acute severe arrhythmia, like cardiomyopathy, also severe myocardial disease, cardiac tamponade, etc., etc. These are all cardiac causes of pulmonary edema or alveolar edema. And the other category is the non-cardiac pulmonary edema or the non-cardiogenic pulmonary edema, as it happens in acute respiratory distress syndrome, which of course is a final complication of many medical systemic diseases, like, for example, patients with acute severe pancreatitis, patients with DIC, patients with renal failure, severe renal failure, patients as an end stage of severe pulmonary infection. We get also acute respiratory distress syndrome, which is non-cardiac pulmonary edema. It is alveolar edema secondary to a non-cardiac cause, whether systemic cause or respiratory cause. Another alveolar disease, so I have mentioned emphysema, I have mentioned pneumonias or alveolar infection. Number three, alveolar fluid or what we call alveolar edema or pulmonary edema. And then also we have another alveolar disease, which is alveolar hemorrhage. That is hemorrhage inside the alveoli. And this might be related to many systemic conditions, most commonly in vasculitic syndromes. For example, we have some vasculitic disorders or collagen vascular diseases associated with alveolar hemorrhages. So it might be autoimmune. And also we have alveolar protein accumulation or proteinaceous material accumulation in the alveoli in some pathological processes, which we call alveolar proteinosis syndromes or alveolar proteinosis disease. This is a special category of alveolar disease. So alveolar proteinosis, there is accumulation of proteinaceous material inside the alveoli in some pathological conditions, which we have to understand them and we have to study them as a special category of alveolar diseases, the alveolar proteinosis. So, again, to recapitulate, emphysema, number two, pneumonias, which is alveolar infection. Number three, alveolar edema. Number four, alveolar hemorrhage. Number five, alveolar proteinosis. And number six, we have also the another important alveolar disease, which is the desquamative interstitial pneumonia or fibrosing alveolitis, which is a very big category of alveolar diseases affecting the alveolo-capillary membrane, causing a diffusion defect of the lung. So here the pathophysiology or the pathobiology is a diffusion defect due to diseases affecting the alveolo-capillary membrane, that is the membrane of the lung, which includes the capillaries or the alveolar capillaries and the adjoining the alveoli. So we call them the alveolo-capillary membrane. This is which is responsible for diffusion of gases, and that's why in this diseases which affect the alveolo-capillary membrane. The group of diseases, we call them the fibrosing alveolitis or fibrosing alveolytic disorders, whether primary fibrosing alveolitis or secondary fibrosing alveolitis associated with systemic diseases, and these are many. We call them also sometimes the desquamative interstitial pneumonia or the DIP, or sometimes we call it the diffuse pulmonary fibrosis or the diffuse pulmonary fibrosis, the DBF, or sometimes we call them also the desquamative pneumonias. They involve the alveoli, they involve the alveolo-capillary membrane, so there is gas diffusion defect, there is hypoxia, and these disorders are also many fall under the category of what we call interstitial pulmonary disease. Same like the obstructive pulmonary disease, but obstructive, it is the pathological defect is an obstructive hypoventilation problem. Here in the interstitial pulmonary diseases, the defect is a diffusion defect because the anatomical part of the lung involved by the pathological processes is the alveolo-capillary membrane, which is responsible for gas exchange. So the primary defect here is in the gas exchange. And the pathological group of diseases, we call them interstitial lung diseases or interstitial pulmonary diseases or fibrosing alveolitis or desquamative interstitial pneumonias. They are the same. And here the alveoli are involved by a fibrotic pathological process. And we have two categories also here, primary fibrosing alveolitis and secondary fibrosing alveolitis with many associated with many systemic diseases. So fibrosing alveolitis is another group of diseases involving the alveoli. So to sum up, we have emphysema, which is an obstructive pulmonary disease. Number two, alveolar infection, which is pneumonias, and this is a very common popular clinical condition affecting the lungs, التهابات الرئوية, pneumonias. It's an alveolar disorder. It's an alveolar infection. It's pus inside the alveoli. Then we have also pulmonary alveolar fluid, which is alveolar edema or pulmonary edema. Then we have the alveolar hemorrhage. Then we have the alveolar proteinosis disorders. Then we have the alveolar fibrosis or fibrosing alveolitis. This is in short disorders affecting the alveoli or alveolar pulmonary diseases. Of course, this is in short summary of the pathologies or diseases involving the alveoli, which are the small gas exchange units of the lungs. الحويصلات الهوائية، الأمراض التي تؤثر على الحويصلات الهوائية والتي هي شائعة في الممارسة الإكلينيكية اللي بنشوفها كتير كأطباء. Remember alveolar diseases. Of course, the last one before I finish, so that we have mentioned all, is the alveolar cancer, or what we call alveolar carcinoma, or the adenocarcinoma of the lung, which is a type of non-small cell lung cancer. So the last one, which might disease which might affect the alveoli also, is a type of lung cancer. To be more precise, it is a type of non-small cell lung cancer, which is adenocarcinoma or alveolar carcinoma. Adenocarcinoma primarily involves the alveoli, and it is a type of non-small cell lung cancer because, as we all know, lung cancer is broadly classified into small cell lung cancer and non-small cell lung cancer. And in the non-small cell lung cancer, we have the squamous cell carcinoma, which involves the proximal airways, which is common in cigarette smokers. And then we have also the adenocarcinoma and the alveolar cell carcinoma and the anaplastic carcinoma of the lung. So the adenocarcinoma, which involves the alveoli, is also a pathological process which might affect the alveoli. Thank you so much, Professor Dr. Tarek Ali. My regards to all of you.